As America's doctor, how do you think primary care physicians can partner with communities, coordinated efforts to prevent chronic diseases like obesity?
This is a great question. I will say that this is a question I've thought a lot about as somebody who is a doctor and who has many colleagues who have come to the profession with the highest of ideals, but who are burning out. And many of us know healthcare practitioners who are frustrated, who have become cynical, and who are burning out. And we have to ask ourselves the question, why is that? And if they're feeling that way, can we add more and more and more to their plate? And so I actually think that we have to rethink what the doctor or nurse of the 21st century do. Because the mission might be the same, which is to improve the health of a community, but we have to expect that the role that doctors and nurses, for example, play is going to change over time as the needs of the community change. Now, we know that our nation invests far more in treatment than in prevention. That's something we talked about a lot earlier this morning. But the question is, who's going to make that shift for us? Who's going to ensure that we're investing more in prevention, that we're implementing prevention programs, that we are bridging those traditional gaps that have existed between medical practices and personnel and public health interventions that are out in the community? And I would argue that I think this is a role that the physicians and nurses and pharmacists of the future can actually help play, which is bridging that gap. For example, like the physician of the future may only spend part of their time in clinic seeing patients. They also may spend part of their day working with YMCAs, with other community organizations to help build the kind of connections and support that their patients so desperately need. There are a couple of doctors in Iowa who actually played this kind of role a few years ago. In Iowa, there's a place called Murthy Medical Center, which today is actually located very close to a YMCA. But that wasn't always the case. And they had an interesting problem before this co-location happened, which is that doctors at the hospital would see patients who needed to lose weight, and they would recommend that they got more physical activity and they ate better. But they didn't have the support to follow up with them and to make sure that they knew how to actually implement that in the community. And on the other side of town, you had the YMCA, which had built some extraordinary programs to help people stay physically active, to train them on what to eat, to help them access good nutrition in their communities. And they were looking for people to help. It just so happened that two of the doctors who worked at Murthy Medical Center were on the board of that YMCA. And they suddenly had the light bulb went off and they said, oh my gosh, we have a referral source and a referral destination, and this could work out really well. And because it just so happened the YMCA was looking to relocate, they decided to co-locate it with the hospital. And so you have now this great situation where people can refer, doctors and nurses can refer patients to the YMCA knowing that there is somebody who can help them, their patients, to implement these lifestyle changes, prevention-related changes that they need to make. So if we allow ourselves to think beyond the natural confines and the historic confines of what the job of a nurse and doctor have looked like, then I think we can start to be creative and find that there are things that we could be doing as doctors and nurses that could help our patients far more than the advice we may be able to dispense in 2 to 3 minutes at the end of an appointment. And that could be, again, working directly with community organizations. It can involve convening. I would love to see healthcare providers play more of a role in convening community groups, including policymakers, to understand the importance of prevention. This is a new type of leadership. It's a different kind of leadership, but I think it's the kind of leadership that the 21st century demands and needs from healthcare providers.
This is really relevant, I think, with us starting the new Dell Medical School here. So thank you for your remarks.